vital signs for granted as just another routine in nursing. But the more I think about it, the more I realize how much hinges on getting those early warning signals right.
Absolutely, and not just because it's traditional. I remember on my first placement, we had a patient whose vital signs tipped us off to a serious deterioration long before they complained of any new symptoms. It's like being a detective for the body's early clues.
Right, and it's not just about recognizing a number that's off. It's about understanding the whole context, like body temperature, pulse, respiratory rate, blood pressure, even oxygen saturation. Each tells a piece of the patient's story.
Exactly, and knowing when to check them is crucial too. Whether it's before and after surgery, when a medication is given, or if the patient just feels off, those are the moments that can make all the difference in catching an emergency early.
That actually reminds me, body temperature is one of those vital signs that can be deceptively simple. People always think fever equals infection, but there's so much more nuance, isn't there?
Totally. Body temperature can shift for all sorts of reasons: age, the time of day, hormones, even if someone's feeling anxious. Plus, the method we use to measure it, oral, axillary, tympanic, can each give a slightly different reading.
Yeah, and those little differences can matter. For example, axillary readings tend to be a bit lower than oral or rectal. And with new infrared thermometers, there's also the convenience factor, but sometimes less accuracy.
And when it comes to fever types, it's not just high or low. There are patterns like intermittent, remittent, or relapsing fevers, which can hint at underlying conditions. It's like temperature has its own language we have to learn to interpret.
Moving on, I've always found pulse and respiration fascinating because they're so immediate. Just placing your fingers on a wrist or watching someone breathe gives you real-time insight into how their body's coping.
That's so true. And there's a lot to pay attention to, not just the rate, but also the rhythm, the strength, and regularity. Like, tachycardia or bradycardia can signal a ton of different issues, depending on age, activity, or even medication side effects.
And with respiration, counting breaths without the patient realizing is almost a bit of a nursing art form. Otherwise, people start breathing weirdly because they know they're being watched. Plus, evaluating things like depth and pattern can reveal problems like dyspnea or even early hypoxia.
Last week, we got stuck on differentiating between Shane Stokes and B.O.'s breathing. Those classic patterns can be subtle in practice, but spotting them early can really change a patient's outcome.
Funny you say that, because blood pressure is another area where the details really count. I've seen plenty of errors just from the wrong cuff size or arm position.
Oh, cuff size mistakes are the classic rookie error. Too small and the readings are too high, too big, and you might underestimate. And don't get me started on measuring overclothing or with the patient's arm dangling below heart level. Instant recipe for unreliable numbers.
And then there's the importance of letting the patient rest, checking both arms, and using the right technique like deflating the cuff slowly to actually hear those Korotkov sounds. It all matters when you're trying to catch things like hypertension, hypotension, or orthostatic changes.
It really highlights how blood pressure isn't just a single reading but a trend to watch over time, especially when you think about the risks: stroke, heart attack, kidney disease. Getting it right is a big responsibility.
After covering the classics, I've noticed more focus lately on oxygen saturation and assessing consciousness. They're now pretty much standard in all patient monitoring.
Absolutely, and it makes sense. With a simple pulse oximeter, we can spot hypoxemia before it escalates. And evaluating consciousness isn't just about checking if a patient is awake, it's about noting changes in alertness, confusion, or response to stimuli, which might signal a neurological emergency.
And now, with wearable tech and continuous monitoring, we have so many tools to pick up subtle shifts in vitals. But none of it replaces the careful, hands-on assessments nurses provide.
You nailed it. Technology helps, but the nurse's eyes, ears, and critical thinking are irreplaceable. Every vital sign is a story, and it's up to us to interpret and act on it for our patient's safety.